So good afternoon, stroke evening, everyone. And it's a pleasure to welcome you to the first session of our third series of Rare Disease Echo, which is a virtual community of practice. And this time round, we're doing this as a partnership between Rare Voices Australia as the national peak body for people living with rare disease, the Rare Care Centre in Perth, Sian Wave. And us at UNSW and Rare Diseases New South Wales. And so I would like to start off by acknowledging the traditional owners of the lands on which we're meeting today. And I'd like to pay my respects to elders past and present. I'm meeting on the beautiful lands of the Gadigal people of the Eora Nation. We'd like to record the first presentation in this session, but we won't record the discussion, so we can create a safe space for everyone to share. And just for those of you who don't know me, my name's Emma. I'm a clinical geneticist and a paediatrician, and I work at Sydney Children's Hospital in Randwick in New South Wales. The next, and I'd like to maybe just go around and say a brief hello to our other ECHO members. So Sian, did you want to introduce yourself?
Would love to. Hello, everybody. My name's Sian. I'm the clinical nurse specialist at the Rare Care Centre in Perth, Western Australia, or Noongar Wudja. So I work in education and workforce capacity building, so all things education for rare disease, and I'm also a rare disease patient as well. So it is a pleasure to be here.
Sian and Libby.
Hi, I'm Libby. I'm a GP, also from WA, and I've been involved with this rare diseases project for a while now, actually, giving a GP perspective and learning a lot in the process.
Fabulous. And Krista's just turned her camera off because she's juggling a lot at the moment, but Krista is our amazing program manager. Hello, there she is, waving at everyone. Beautiful. And so the Rare Disease Echo program is a monthly series of sessions, and they last for 1 hour, and they're to provide professional development support and community collaboration. And today we're very lucky to be joined by Louise Healy, who is Rare Voices Australia's Education and Advocacy Manager, and Steph Broley, who is Senior Genetic Counsellor at the King Edward Memorial Hospital and Perth Children's Hospital. And what would be great is if people are comfortable to just introduce themselves in the chat, if they'd like to say where they are, who they are, and what they're hoping to get out of the sessions would be brilliant. So this is the idea of Project Echo, is we're all teaching, all learning together to share knowledge, and that often it's quite an intimate group where we can really get into some deep conversations and then go into where we're working and think about sharing that knowledge more broadly. So that's why it's called a Project Echo, is it's kind of like a rippling out from the day. And our ultimate goal is to make sure that people living with rare disease have the right care in the right place at the right time, and that equity is a huge focus of what we're trying to do. So just as a reminder, we do have a dedicated webpage on the Rare Voices website. So it's Rare Disease Project Echo, and you can go in and see sessions from previous series. And also we do a summary where any key resources that have been discussed during the Echo are summarized there as well. And so I've introduced you to Louise and to Stephanie, and soon we'll be moving on to their presentations. But just as a reminder, first of all, Louise will be talking, then I'll hand over to Libby for some questions and discussion, and then Steph will be presenting a case-based presentation. All of these are de-identified, so people feel comfortable. Then there's an opportunity for you guys to ask any clarifying questions, so anything that didn't quite make sense. And then we're going to open up to what's called the problem of practice, which is really trying to help solve together some challenges that people are having. Then we can wrap it all up. I'll try and do a quick summary, and we'll get you out of here for your dinners, stroke, exciting rollerblade activities. Beautiful. Just as a reminder, it's really important that we respect people's private health information. So no sharing names or cases, locations, date of birth, other personal details that could be identifying. Only the session's presentations are recorded. It's absolutely no silly questions or answers. We're all in this because it's tough and rare disease is challenging. We'd love you to have your web cameras on, but we also know it's a tricky time and we don't mind, as Krista is beautifully demonstrating, if you have an accompanying young person or old person. And any IT issues, feel free to, particularly Krista and Natalie Roberts in the chat are here to help in the background because I'm useless with IT. Okay, that is my bit over and I am going to hand over to Louise.
Hi everyone, thank you for having me. I'm just going to get my slides up quickly and put them into presenter mode. Thank you. It's a real pleasure to be here today and be part of this. I am, as Emma said, Education and Advocacy Manager at Rare Voices Australia. I'd like to acknowledge the Yagara and Turrbal peoples whose lands I'm presenting from today. I'm also a rare disease parent and I have postgraduate qualifications in psychology. So if you don't know, Rare Voices is the peak body for people living with a rare disease. The main, I guess, strategic focus of our work is the National Strategic Action Plan for Rare Diseases, which is the government policy position on rare diseases. The focus of Rare Voices is on policy and system change to address the common challenges faced by the rare disease community. And to do this, we work in partnership with more than 100 rare disease specific organisations, as well as researchers, clinicians, government and industry. And currently we are leading the development of the Rare Portal, which I'll speak about as time goes on, and managing the Rare Helpline, which I'll also speak about. So just to give some background about why are we talking about mental health in the rare disease space, because really having a rare disease, being diagnosed with a rare disease or having a family member diagnosed with a rare disease has a significant impact on people's mental health and well-being. And the research indicates really strongly that there's a high incidence of mental health issues across the person with the rare disease, but also their family and supporters. And the kinds of things that people are reporting is anxiety, stress, low mood and emotional exhaustion. And for those, I've noticed that a fair few people in this group have that lived experience, so the stress and the worry that goes, and that prolonged stress that goes with a condition that's not well known and well understood, and where you don't really know what's going to happen, where there's not much information available, where it's hard to meet other families who are sharing the experience. So the kinds of things that people report is feeling of isolation, the challenges of getting diagnosed. So many of you will be aware that rare diseases can be associated with quite a long time to diagnosis. There are a lack of treatment options. Only 94% of rare diseases have a treatment for them. Care coordination is difficult, and all of these factors contribute to poorer mental health outcomes. So in Australia, some research indicated that regardless of the severity of the rare disease, the impact on the psychosocial impact is rated as high to moderate by most families. And people are still not routinely offered psychological support, even though it's fairly well known now that they are likely to have some challenges with their mental health and well-being. Parents and carers of children report more anxiety and confusion than those with chronic illness. So one of the things that we commonly hear when we start talking about rare disease and mental health is, oh, it's like chronic and complex. And it is like chronic and complex, but it's chronic and complex plus. So it's all of the challenges that are associated, plus a whole range of other things. Families report feelings of fear, uncertainty and worry, and siblings are also significantly impacted. So I think I've talked about quite a few of these things already around that isolation and loneliness, which is something, but even things like not being properly acknowledged. Many of the people calling the Rare Helpline at the moment feel quite lost, or they're not being taken seriously, or they have nowhere to go, or they're told regularly by medical professionals that they will need to be the expert, which is another quite unique challenge for people living with rare diseases, that often as a rare disease parent, you will be with a doctor and you will know quite a bit more about the rare disease that your child has than they do. There's a lot of ongoing and anticipatory grief. Many rare diseases are progressive. They often start in childhood because there's so many of them are genetic in option and then in origin. And then the other thing that I think is quite hidden is that, and this is happening right at the moment in Australia, that when a clinical trial comes and there is no other treatment option, there is so much hope and so much wrapped up for a family in being part of a clinical trial or trying a new treatment, and when it doesn't work out or a trial is stopped for some reason that you may not fully understand, that's completely devastating for families. So that's the picture. So what can healthcare professionals do for the mental health and wellbeing of their rare disease patients? So the first thing is to follow the national recommendations for rare disease healthcare. I just realised there's a spelling mistake there. So recommendation 6 particularly relates to mental health and wellbeing. And these national recommendations are the result of the Rarest project that Project Echo was also, Rare Disease Project Echo also started in. And it's the result of extensive collaboration and consultation with a whole range of health professionals, with people with lived experience of rare disease and researchers and clinicians. I guess the most important thing that a healthcare professional can do is routinely ask how people are going and then signpost appropriate supports and resources. Another thing that you can do is learn from the voices of people with lived experience about their mental health needs and challenges and what they find most helpful. And as a part of the Rarest project, again, there are some lived experience case studies that I encourage anyone who's working with people with rare disease to go and listen to what people had to say and learn from. A really important thing I think that a healthcare professional can do is reduce stigma about mental health issues by normalising the mental health challenges for people living with a rare disease and talking about it. And really what we heard from our stakeholder reference group, so all of the resources developed through Rarest were co-designed with people living with a rare disease. And one of the biggest things we heard is, I wish somebody had spoken to me about this earlier. I wish the challenges were flagged for me and I was connected with the right services earlier, because it's quite obvious from the research that there are going to be long-term challenges. The other thing that we hear from families is the importance of shared decision-making and partnership with families when you're treating someone with a rare disease, and they feel most appreciated and empowered when they're seen as part of the care team. And finally, obviously, referral to a mental health professional is really useful. Resources are available to people for you to use. So there's a whole range of resources. So there is on the Rarest website, the Rare Voices website, there's a digital mental health resource fact sheet. And again, this is a result of the Rarest project and of feedback from people living with a rare disease that getting access to a mental health professional is often challenging for a range of reasons. So they might be financial, but often they're quite practical reasons that when you have a family member with a rare disease, they're often multi-system rare diseases, you already have a lot of medical appointments to attend, you have a high care burden. So to arrange your own appointments becomes just another thing that's too much for people. So digital mental health resources were seen to be a way that people could access supports in their own time, in their own home. And as part of that, we did do some work with MindSpot, which is one of the providers, and do some rare disease awareness and education with our clinicians. The other thing that we know is isolation, and I spoke about it earlier, and loneliness is a huge contributing factor to some of the challenges people experience. So one thing that people really appreciate is if they want to be connected with a support organisation where they can go with people who share their experiences and their story, learn from each other and get support from people who are going through the same thing. So there is a list of an A to Z of support organisations. Obviously, it does not cover all rare diseases, but as much as possible, we try to point people to somewhere where they can talk to someone else who's got the same condition as them. If you're looking for evidence-based information for the Australian context, the Rare Portal is a project being led by Rare Voices Australia in collaboration with the sector and developing information resources and signposting support resources. You can also refer your clients to the Rare Helpline, and this is a relatively new service that is the result of a government grant, and it is a service navigation service. So callers call the Rare helpline and get service navigation, emotional support from people with lived experience. So the RVA team are doing that, and that they also can be referred to two trial sites who have rare disease nurse navigators, and one of the trial sites is at the Rare Care Centre and the other is at the Sydney Children's Hospital Network. And the purpose of those nurse navigators embedded in those health systems is that more wraparound care and connecting people and connecting their care. There are some specific resources for Western Australia for consumers and for health professionals that were supported. The Western Australian government supported the development of those. And in addition, there's some resource collections for Aboriginal and Torres Strait Islander people living with a rare disease, people from culturally and linguistically diverse backgrounds living with a rare disease, and people living in regional, rural and remote Australia with a rare disease. So they are all available and things that you could refer your patients to. And just to maybe help a little bit, I was asked to talk a bit about the Rare helpline and what is coming in. So I'm managing the Rare helpline in my role at Rare Voices Australia. So what we're seeing is a lot of complex cases and many where there isn't a specific rare disease support group to refer them to, and often they're quite lost in the system, I would say. I think before we started, I imagined that this would be a fairly straightforward helpline. We would refer people to our nurse navigators and to our rare disease organisation partners, but really we are getting so many people that don't have an organisation to go to, that don't have a clinician to go to, that there's no expertise in Australia, or if it is, they can't find it. So the focus is service navigation, but virtually every call is incorporating some level of emotional support, recognition, acknowledgement, validation, the normalisation of their feelings, but also increased health literacy and empowerment. So a lot of health system navigation support being provided through the helpline. And then, as I said earlier, we could refer to the trial rare disease nurse navigators at the Rare Care Centre and the Sydney Children's Hospital Network. And that it's great that we've got those, and it's a huge benefit to be able to refer those ultra complex cases in there and know that they'll get that wraparound care. And in addition, I guess what the helpline is giving us is an opportunity to really collect some data and information on where the gaps are and what the impact of the gaps in health and care are for those people. And there's just a summary of the calls that we've had. I think the biggest surprise for me, again, is that I anticipated that we would hear more from parents and carers than we would from people with a rare disease, but actually it's the opposite, and adults with a rare disease are definitely amongst the most finding the health system not meeting their needs and experiencing the most challenges. And that's it for me, so I'll stop sharing.